So Jennifer's going to share her experience with her total knee replacement. I did a total knee replacement on her right knee approximately 1 year ago. And she came into clinic and graciously agreed to let us video her and just ask her some questions, mainly so that we could educate other patients out there about what to expect as a final result, but also just to remind them what it looks like when they're recovering, because there are going to be times that they're hurting and they're wondering, hey, where's this going to lead? Is this worth it? Is this abnormal? And just hearing from other experiences, I think, is really powerful. Now, one of the things that's, I think, noteworthy with her story is that she said at 1 month, that was the first time that she was really getting out of the house. It took her a whole month before she could get mobile. And that's significant. I think most patients get better quicker than that. But in her case, it was really hard. And later I asked her, how long before you could say you were better than you were prior to surgery? And her answer was 3 months. It was 3 whole months before she had actually made forward progress, before she could say, okay, I think I'm glad I did this surgery. It's an investment. Now, not everybody it takes that long. I would say it's closer to 6 weeks that the average person can say I'm better than I was before. The worse you start out at, then the quicker you're going to feel like you made improvement. But my point in highlighting that about Jennifer's story is at 3 months, that's the first time that she felt like she was better. Now she's at a year, and you look back and you say, how did this affect your life? And she let her words speak for herself. I'll let her words speak for herself, but she had a tremendous response and a really good outcome. And so if you are considering a knee replacement, just consider the cost. And if you are recovering from one right now, know that even if you're having a hard time, even if it's a month or 2 months in, that doesn't mean that your end result is not going to be good. In fact, it can be really hard the 3 months, and that's very common for patients. So if you have had a knee replacement or you were considering getting one, use this just as a way to set your expectations and hopefully to encourage you some, especially if you're 1 or 2 months into a knee replacement and you're still struggling. Now, it doesn't mean that you're going to get better, but it certainly doesn't mean just because you're struggling that you're not going to get better. And that's the point about Jennifer's story. At 2 to 3 months, she was still struggling. And at a year now, you can see what a wonderful outcome she has. So hopefully this gives you some hope. And if you are considering getting a knee replacement, please come and see us. I'd love to take care of you if you're in the Austin area. Thanks.
It's 100% better. I didn't realize how bad it was until it got better. And I think I've told you before that I wish I'd have been in circumstances where I could have done it several years ago, but I really felt like I needed to retire first. But it's given me back a life I had forgotten I had. You know, I don't limp anymore. I don't drag my foot anymore.
Okay.
I can sleep at night. I'm not in constant pain. It's way better and it's awesome. It's just great. I had gotten to the point where if I got more than half a block from the house, I was scared I wouldn't be able to make it back. And so now I'm walking about 45 minutes a day during good weather, and I ride my bicycle, my elliptical bike, for 20 or 30 minutes a day if I can't go walking. Well, the first month sucked, to be real honest. Though I have talked to other people that didn't have it as bad. I think because I have a sensitivity to medication, that it was kind of a balance between what it would do and what would knock me out. So I think that was some of it. But it's not for the faint of heart. You need to make your little bum nest with whatever you want sitting by you, because you don't want to get up. For about the first month. And then after that, I was so bored I got up anyway and started tooling around with a walker and going outside and sitting in a chair and pulling weeds. I had a friend that had, man, it was tough. Yeah, if I was going to lose my life, like I lost my life for probably 3 or 4 years, yeah, I'd suck it up and do it again. I don't drag my foot. I don't limp. I walk like, it's been so long since I walked well, I feel like I walk like a younger person. Don't put it off. All you've got to lose is a disability.
Yeah.
It was tough, but I recommend it.
All right.
See you later.